All right, welcome everyone. We'll go ahead and get started. I'm Amelia Josephson with the Financial Health Network. I lead our Financial Solutions Lab Exchange program, and we're excited to have you with us for today's webinar on closing benefits gaps. For our agenda, I will give some brief context on why we chose benefits for the focus of our 2022 Financial Solutions Lab Exchange grants, what we learned about benefits access from our Financial Health Pulse data. We'll then have a presentation by one of our grantee partnerships, Benefit Kitchen, LISC Houston, and Connective. And then there will be time for Q&A. So please, while I'm talking, while our presenters are sharing, make full use of the chat and Q&A features. We'll be pulling your questions and reactions and sharing them with our speakers during that Q&A portion. Before we close, I'll share a little bit about some upcoming events from the Financial Health Network that you can join later this year. So by way of background, one of the reasons that we chose to focus on benefits for our 2022 to 2023 exchange grant program is that we really saw the impact of benefits in our data. Our 2021 Financial Health Pulse survey found that during the pandemic, the peak of a pandemic in 2020, people who applied for and received unemployment benefits or debt relief were more likely to be able to pay their bills on time than applicants who did not receive benefits or relief. And so we awarded grants to 3 nonprofit fintech partnerships in the benefits space in 2022. You may have joined us in April when we hosted a webinar featuring grantees, the Flagstone Initiative and Mocafy, talking about ways to help people who are behind on their rent. And we hope you'll join us in August to hear from our 3rd grantee partnership, Nebraska Early Childhood Collaborative and Pi for Providers, who are focused on the financial health of child care providers. So just from those few examples, you can see that benefits are crucial really across so many sectors. And we know that public benefits in particular could benefit millions more if we could close benefits gap collectively as a field. And those could be benefits that help people deal with an acute crisis like unemployment or an ongoing shortage of money for essential costs like food and housing. And with that little bit of context shared, I'm going to turn things over to our presenters today and ask them to turn on their cameras while I introduce them. You'll be hearing from Dan Beebe, CTO at Benefit Kitchen, Ellery Maku, Program Officer at LISC Houston, Kevin Argueta, Program Associate at Connective, and Melissa Langston, Data Analyst at Connective. Over to you.
Great. All right, thank you. Today we'll be talking to you about benefits, public benefits in one of the programs we're running here in Houston. The area of our study is actually Harris County, which is located within the bounds of Houston, Texas. Next slide, please. So as Amelia mentioned during her introduction, public benefits are sorely underutilized by those who need them most. A recent study listed that at least 65 billion go unclaimed nationwide, which accounts for about 25% of entitlement benefits, which is a huge percentage. Next slide, please. And within Harris County, we did a study that found that $1 billion in public benefits alone within Harris County go unclaimed. And it's even more important now with 1.3 billion coming to Harris County through the Inflation Reduction Act, and really trying to get this money to the people who need it the most for anything that they can use to help them. Next slide. This is a study that we did with the Benefits Data Trust so that we could really narrow down in Houston, Texas, what is the most need and what benefits are people seeking, or what benefits do people need to be seeking. Some of the biggest heavy hitters here were the Affordability Connectivity Program, which almost 500,000 households are eligible for but have not claimed. And then we had almost 100,000 people who are eligible for SNAP who had not applied. And then for LIHEAP or CAP, the Comprehensive Energy Assistance Program, 1.6 million people are eligible. However, that's not an entitlement; it's a grant-based program. So there's just not enough money left on the table to provide for that. That's the same with Gulf Coast Solutions Financial Assistance for Childcare. That's a local childcare program here administered by Workforce Solutions here in Texas. So you just see overall, just shy of $1 billion in Harris County is there for people to take advantage of, but so many people are not. Next slide. And our best estimate, almost 500,000 households or residents in Harris County are eligible for some type of benefit, but aren't using them. And so we have a solution.
Yeah, welcome everybody. The importance of income supports, as Amelia mentioned in her introduction, income supports are important both in an acute crisis and for ongoing support. So why income supports? Coaches that work in community-based organizations provide personal and relationship-based focus for assistance. So they're invaluable for that person-to-person assistance. And the tool to access the public benefits is invaluable for its ease of access. The tool alone or the coach alone don't make as much of an impact as the two together. So coaches are trained to assist clients with finding and applying for benefits in parallel with workforce and financial stability. And they're able to incorporate income supports as part of the family's overall financial health instead of a standalone service with the connotation of neediness. Income supports are part of the journey and do not have to be permanent. Our income supports tool pilot, this project we're working on, is to make coaches' jobs more efficient, less of a burden on both the coach and the client, and using the tool to assess the benefit eligibility, be more personalized, and allow for less money to be left on the table or unused in the benefit system. It's a part of the client's journey and not something to be ashamed about, money that they can use for their financial stability. Next. So thank you to Dan for finding this information. This is from an analysis of the 2019 Medical Expenditure Panel Survey. And you can see just a small portion of the population is responsible for a very large percentage of the total healthcare spending, according to kff.org. Lack of income supports contributes to a shorter lifespan, less education, more likely to drop out of school, many different health issues and implications that you can see in tiny print on the right. If we consider social determinants of health, or even just the health of a community, it's important to consider income supports as a means of support. So if you increase a community's health or a family's health, you can increase their household wealth too. Next.
Ellery, can I just pop in one couple little points? So going back to what Melissa said and Ellery has just said now, the good news here, there's a little bit, is that 92% of families, according to Annie Casey, apply for benefits on their own, but they often don't apply for all of the benefits. And so really sort of getting all of them together is going to help lower these negative health outcomes. And so that's what we're going to talk about. There are a couple of questions that came up in the chat about unclaimed benefits. That's a little bit of a mystery, right? They either go back to the federal government or they get spent on other programs. So like TANF dollars, for example, can go into abstinence programs or marriage planning programs. So that money that's withheld can go into sort of other education programs, can even eventually be spent on roads and things like that. So that money that's supposed to go to households, eventually sort of flows into other pockets, and sometimes quite fraudulent areas of spending. And then we'll talk a little bit later about how you can access the income support tool. So hold off on that question for just a tiny bit, but thank you.
Awesome, thank you, Dan. And so after sort of evaluating like how underutilized public benefits are and thinking about the coaching model that was already in place at LISC Houston, we worked together on this income supports tool as a solution for getting more people using more benefits. And so it's basically a screening tool that helps people determine their eligibility for a variety of benefits. So like most people might know that they may be eligible for SNAP, but they might not know about utility assistance that they might be eligible for. So definitely want people applying to various benefits that they may be eligible for. Another thing the tool does is helps these people, enables these people to apply for those benefits, either on their own or ideally with the help of a financial opportunity center coach. And at the moment, the tool is really being used by coaches as a tool that for intake, and really helps them evaluate what eligibility they have for what public benefits. Next
I
slide.
was muted. Next slide, please. So you heard Kevin mention financial opportunity centers, and you might be thinking, what are financial opportunity centers and what is their role? That's a great question. LISC, Local Initiatives Support Corporation, of which LISC Houston is one local office, and LISC Houston is participating in this program with Connective and Benefit Kitchen. LISC has a model called the Financial Opportunity Centers, and these centers are housed within a local community-based organization. The Houston network is in its 13th year, and each year FOC partners receive funding and technical assistance from the local LISC office. There are 3 legs of the FOC coaching model, which I alluded to before, and those are financial stability, workforce development, and income supports. So you see that income supports were already a part of our model, along with workforce development and financial stability. So the model is unique because all 3 coaches or legs of the stool work together and focus on relationship building to help clients move to a new level of income and wealth for family financial stability. In 2022, over the course of the year, the Houston FOC network assisted over 1,000 clients with these 3 coaching relationships. Again, the impact is from the personalization, the coaching plus tools available to help the coaches help their clients access supports or the learning that they need. Both of these help people apply for what they may not know is out there. Coaches know the client, and the tool provides the access to make the process more efficient and easier, allowing the coach who understands the need to work better with the client who can access the funding they need for family financial stability. Next.
And so here we have a brief project description of the pilot that we're working on. So again, the reason that we're working on this is to bridge the benefits knowledge gap for coaching staff and give clients more standardized and up-to-date screening information for benefits. And again, in this pilot, we're studying how to best embed Benefit Kitchen's screener into LISC Houston's Financial Opportunity Center coaching model and software. And again, so the people working on this, so we have LISC Houston, again, they're providing the Financial Opportunity Center coaches, so they're the people really working with the clients. We have Benefit Kitchen, who created the tool, and then Connective is helping implement that tool into the flow that the coaches go through. And so we've been working on this project since 2021, implementing the tool, training coaches, and continuously collecting feedback from coaches. There's a lot of change management work, so it's been really, really helpful, like working on these things together. And the project ends in September 2023. And so right now, the pilot really focuses on LISC Houston's Financial Opportunity Center, but our goal is to have this implemented at LISC National. And so at the end of this pilot, we're gonna have a report, and we're really gonna talk about coach feedback, like what coaches said, best practices, and really give recommendations on how to best implement the tool at a wider scope. Next slide, please.
So At Connective, one of the things that we like to do when we're trying to analyze how we tackle a problem is to create personas. So Sarita is a persona that we've used before. In this persona, she has 2 children who are both under the age of 5, and she's married, but she's a stay-at-home mom. Their household income is $3,200 a month before taxes, and they are currently receiving SNAP. And so Sarita meets with the local Financial Opportunity Center coach to go through the screener to see what else might be available for her family. Next slide.
And so I think someone's going to drop a link to the to this screener in the chat. But at this point, we'll talk a little bit about how the screening tool works. There are some questions that have come up in the Q&A. I'll try to address those in this section here as well. But basically, what we have is a screener that asks some basic information about, and sorry, one other caveat on the screener tool. Please don't make any changes to the screening because you will affect that for all the people who see it. You can click back and forth between the screener and the benefits. There's a link in the upper right-hand corner that says back to screener, and you can sort of see the questions that we ask for. But a Financial Opportunity Center coach would use this with a client. They would answer at the top of the page the client's zip code, and then the age of the head of household, and then the ages of other individuals who live there. So any adults or children who live in the household would be entered in. Then we would ask for information about income from several different sources. So earned income, obviously, but then also SSI or SSDI income, work study income, income from other sources, including other benefits. Then we would ask for information about expenses. So this would be rent and food costs, basically, but also transportation and some utility costs. And then other information that might fast track individuals in this household for Medicaid, for example, information about breast or cervical cancer, and some other healthcare related questions. All these questions are asked contextually. So, you know, if the client indicates that they're not married, we're not going to ask them whether they're filing their taxes jointly with their spouse or not. And these are all the questions that they'll be asked in the forms that they need to fill out in order to apply for all the benefits they need. But we're using this information to determine what their eligibility might be. So we collect all this information. Some things you should know we're not asking about. We're not asking for their address or their social security number or the names of any of the individuals of the household. We're really just asking for anonymous information. And this information can be changed and updated so that a client can sort of workshop different scenarios. So for example, if they're part of an FOC job training program, they can see what their benefits what might happen to their benefits when their wages go up, for example. So on the next slide, we'll take a look at the benefit eligibility that's returned after the client goes through the screener. And this is where the sort of the special sauce of the Benefit Kitchen screener sort of comes in. It is where we sort of determine benefit eligibility and provide a dollar estimate for each of the benefits so that the Financial Opportunity Center coach and the client can make informed decisions about what they want to apply for or not. So in this case, this family, Sarita's family, is eligible for $281 in SNAP. That is a big benefit that they'll definitely want to go for. In the healthcare realm, the adults in the household are eligible for a silver plan under the ACA with a small $66 a month copay. So we make an estimate there about what their silver plan will cost in the state of Texas. And the children are eligible for CHIP. So that's the Children's Health Insurance Program, and they will have a $0 copay for that. So the kids and the adults can sign up for healthcare. In the case of utilities, they're eligible for the Home Energy Assistance Program, which is called CIP in Texas at the tune of $13 a month. And then tax credits, a combined tax credit sort of bolus for this household in the form of earned income tax credit, child care tax credit, and child tax credit. That information is delivered on the screen so that they can see which benefit they're eligible for. They can be connected with a VITA site, for example, to get those tax credits, a food stamps office to be able to apply for SNAP, and et cetera, et cetera. So in this case, the Financial Opportunity Center coaches create the screening. They go through this with their client, but they can text a link to the screener to their clients either via SMS, or they can email it to their client. So that information can be stored on the client's account. They can send that information out. I don't think you guys share the links with your clients, but the ability does exist within the system. And the tool is available in Texas, obviously, but in 12 other states for the screener, and our application programming interface, our API, is available in 32 states. And we'll be saying a few more words about that in a little bit. On the next slide, we'll talk a little bit about the screener portal, the screener potential in at LISC Houston. So basically, the bubbles here show the scalability. The key recommendation to LISC, or sort of any of the other key markets that we want to sort of expand this to nationally. But in this case, we have 4 of LISC's partners here: the Alliance, the Chinese Community Center, Volunteers of America, and Wesley Community Center are all sort of under the umbrella of LISC Houston. And so the administrators at Connective can see all of the cases. They can see all of the clients that have been screened by all 4 of these institutions. And any new partner can be added instantaneously. We basically just need to set up another partner that can be added on the same day. And all of the data that happens for all of these partners happens within the screener, and the administrators can see all that information. Is there anything else, Melissa, Ellery, or Kevin, that you guys want to add to this, to that slide? Okay. So on the next slide, and jump through to that one, there is a sort of a nonsensical structured data call here on the right side. I apologize for putting something technical on my slide, but this is what's called a JSON file. It's basically structured JavaScript data. And so the API returns this information. It basically collects all the same information you can see in the address bar at the top of the page of this image, where it says api.benefitkitchen.com. And then there's the monthly income of the household. There's the childcare costs. There's all of the parameters that we collect within the screener are sent over to the API, and then they're returned in a structured data format. Now, the goal, and the reason we're pointing this out, is that this benefit screening, these benefit screening elements can be built directly into LISC CRM. And so the caseworkers can basically work within the system that they work with on a day-to-day basis with their clients. They can do their intake within Salesforce. They can get all the data from the client to do a screening, and then just push a button, and all that data will be sent over to the Benefit Kitchen API, and then returned underground basically to the CRM, to the client relationship management system, in this case, which is Salesforce. So all that information really would just sort of, all those machinations would happen behind the scenes. And this is a way to basically integrate the screener directly into the system that LISC uses. And that's the purpose of this grant, was to study that, to effectively build a national solution for LISC.
Yeah, I'd just like to add here, Dan, as coaches work with the clients at the financial opportunity centers, before the screener, the pre-screener, we would have to go into Salesforce and log activity or meetings with the client, and manually look up all of each benefit and what their client might be eligible for, input information perhaps multiple times. And so really what we're trying to accomplish with implementing the screener and gathering feedback is assessing just how valuable this tool is in terms of cutting down the time spent in finding applications, collecting information from the client and entering multiple times, perhaps due to human error, entering things incorrectly and not being eligible for certain benefits. And so this really streamlines the coach's job in terms of having a one-stop shop for benefits access and what the client might be eligible for.
Another great benefit of having all this information within the CRM is that the coach can go back, and if an element of the client's household changes, for example, if they have a child, if they change jobs, if their financial situation or household situation changes in any way, they can just click a button to rescreen the client. And so that can be done in the screener as well, but this sort of builds it all into one location where all that information can just be housed and very quickly accessed. every time a change happens within the household, they can just click the screener button. It'll rescreen the client, bring in the new data, and they can then act on that new data.
So on the next slide, we will go through and return to Sarita, our persona.
So as the banner bar there kind of touches on, Sarita's missing out on an additional $13,100 in either benefits, tax credits, or direct money to them.
And this is important because it's $13,000 that Sarita's family can use. So here we walk through the steps of accessing the screener and working with the coach to find these benefits. So Sarita works with her coach to complete the screener. Based on Sarita's answers and eligibility, the screener generates additional benefits she may want to apply for. Then Sarita decides if she'd like to apply for any of these benefits right now. If not, as Dan mentioned, she can come back later and if she wants to think about it, talk to other members of her family, she can save the place and come back. And then if Sarita decides to move forward, she's going to receive information on what she needs to do to apply. And she can be directed to those specific application methods instead of fishing through information and trying to find where she should apply. The important part of this process is that the decision-making capability is on the client. So nobody's deciding for Sarita and her family what is best for her. They can decide if they want to apply now, if they want to come back later. If, for example, they're expecting a household change and they want to save this information and come back once that change has occurred and things have settled, they can do that. And they can also get information on how to proceed. So they're more informed of the process. The coach is there to help explain and reduce shame and stigma and reinforce that this is part of their decision process and help the client with any concerns. So really the client is aware that they have this extra that they can tap into to help them through this time or however long they need. And then they are equipped with the tools they need to access those benefits. Next slide, please. Thank you. So I'm a passionate advocate now of income supports, in case you couldn't tell. This is Connective's vision. Actually, it's our collective vision, but thanks to Collective for articulating it. We envision a nationwide system where individuals and families have clear, dignified access to public benefits assistance. We want to reduce the image of the welfare queen and the stigma associated with accessing benefits and show that there are so many benefits that go unclaimed that could be used to elevate families, increase their wealth and income, and improve their health, as we touched on earlier. It's not a permanent handout, and it's not something that's that should be people should be ashamed about. It can be a temporary step to get to the next level at work or over an unexpected hurdle in their family. When the family is supported by multiple coaches and they're aware of their options through this benefit screener tool, they can make the best decision for their family and start truly building income and wealth and improving the health of their household and their community. So we strive today to inform you of what we're doing, why this is so important to Houston, and what we expect to do to scale it so that everywhere else is aware of the impact of income supports and what we're hoping to find through this implementation project. Next. And this is where to reach us.
Great. Thank you all so much for that presentation. Go to the next slide. We do have time for Q&A. So if you have a question that you didn't get to put in the Q&A box or in the chat, now is the time to make sure you get that in. Dan, I'm going to combine a few questions that came up that I think you saw about broadly, like working with you, gaining access to your tool, the kind of geographies you served, I think you touched on a little bit. And then, who's the account holders, the coach, the client?
So we're set up for a number of different models. So like we are set up for clients to do self-screening, so they can just visit app.benefitkitchen.com in the 12 states that we currently serve, and they would be able to do their own screening. And so we work with agencies so that they have access to all of their client data within the Benefit Kitchen system, and that's all exportable, so they can use it in whatever system they want to use that in. We also work with our partners to white label the screener. So what you saw earlier in the screenshots was LISC branded. We really want our beneficiaries to feel comfortable using the screener, and one of the ways that we do that is through providing our partners branding, so that they are able to sort of see that this is advocated by the partner. So we work with the United Ways of California and the United Ways of Tennessee and LISC and other organizations, and we basically brand it for them. And then the flexibility is built into it. So again, self-screening, caseworker-led screening, a hybrid model where the client starts it and then they have a conversation with the caseworker or coach. Really, we try to accommodate basically any function. And then, not to belabor the point of the API, but we also integrate that, for example, into texting systems so that clients can text. And so the United Way of California uses this with their 211-211 short code. People can text benefits to 211-211. And in California, they'll be able to do a benefit screening via SMS. So we, basically any interface will work with that. And that is available in, as I mentioned earlier, 32 states.
Great. And I think your contact information and that of the other presenters was just dropped in the chat. So I think if the person who answered that or asked that question has a specific question about their state, they can follow up with you directly. I think the point that you made about using white labeling to help promote trust on the part of the client gets back to a lot of what Ellery was saying about the importance of dignity in the process and reducing shame and stigma. Ellery, we had a question come in about the need to reduce shame and stigma and how exactly the coaches did that. I was very inspired by some of the messaging you shared about like taking steps to get to the next level at work, for example, or, just availing yourself of supports that are out there for you that can help your family. But curious if there's like more specific scripts or directions that you're sharing in your training with coaches.
Yeah, that's a great question. Thank you to the person that entered that. And I think it's a matter of just chipping away at the stigma and the image that we have in this country of who needs assistance and why, realizing that it doesn't always have to be a permanent step, but maybe a temporary situation to help somebody get over a hurdle, and that any unexpected expense or financial crisis can put somebody in that difficult position of needing to seek additional help. That being said, LISC's model of the three-legged stool and combining income supports along with financial stability and workforce training also helps reduce that stigma, because it's a part of the holistic coaching and not a reason alone that people will approach the Financial Opportunity Center. So it's a way to increase income in a different way, and also is combined with the workforce development and with the financial stability work that the client and their family are doing, so that they can elevate themselves in any way that makes sense for their family.
Great, thank you. Kevin and Melissa, we had a question come in that I think Connective can speak to around the change management required when integrating a tool like this.
Yeah, absolutely. So one of the ways that Connective designs is through agile, iterative ways. But the first thing that we always do is take a human-centered focus. One of the actions through this project that we're working on, Kevin and I have been doing interviews not only with coaching staff, but also moving towards interviews with the clients themselves to understand how could this process be improved for them, with the ultimate goal of the end user having the best product available. And once we start with that lens, the next steps really kind of, your goals kind of shift. And, we'll have the buy-in of the frontline support. We'll understand the process from end to end and, make changes as needed, but then do those changes in small chunks so that they're more manageable instead of changing the whole system outright. And really trying to ensure that the process is as streamlined as possible from beginning to end. And Kevin, if you want to add anything, yeah, Dan.
Go ahead, Dan.
I don't know what the experience of the folks at Connective has been with specific coaches, but we do our own training at Benefit Kitchen from time to time as well. And our co-founder, Melanie Lavelle, has done trainings with folks who, are skeptical when she first walks in the room. When she's going to show them the screener, these are usually benefits experts, or at least they'll have expertise in one or two benefits. She'll see a lot of crossed arms and sort of glares when she walks in. After an hour of training with folks, they're much more open, and in fact sometimes they give her hugs when she leaves the room, because she's raised the caseworkers' ability to help their clients get access to 18 federal, state, and local benefits in a way that they just didn't have before. They didn't have the expertise in some of the benefits. They didn't even know what questions to ask about them. And when she goes and does follow-up questions, follow-up trainings a month or so later, you'll sometimes find that these same caseworkers are asking graduate school level questions about benefits that they didn't know anything about before. And so it's basically a benefit simulator. So it's basically a training or education tool around benefits. And it greatly improves caseworkers' ability to sort of understand and field questions about a lot of these benefits, because they are basically steeped in it for using the screener.
Yeah, and we've actually heard that from some of the coaches that have been working on this. Like, they say that this is a great tool for training new staff. They've also said that it's great for building confidence when they're talking to a client. Like, it helps them get more organized about, let's start with these benefits, or these are the benefits that you're eligible for. So yeah, we've been hearing a lot of that as well.
Great. Any other previews that you want to share from that forthcoming report you mentioned, Kevin, around coach feedback and best practices?
Yeah, I think one of the biggest things is probably making sure that when you present the tool to the coaches, just making sure that as you're iterating, like, you always think about making the coach's life easier, and as well, like, making the client's life easier when they're going through this process. And I think that's something that we've heard that it has helped with. So that's been really great. And another thing that I think we're gonna really push for, is really integrating the tool with the CRM that the agencies are using, because we at the moment we are kind of asking people to do the screener on the side, but we don't want people to have to do double entry. And I think integrating the two would be really, really useful.
Yeah, that makes a ton of sense. Dan, what have you learned about the complexity of the benefit systems from developing and deploying this technology? You mentioned that when folks are using the tool, they can enter basically anonymous information. Think of it as more like workshopping. You're not collecting social security numbers. How did you arrive at setting those kind of guardrails?
Yeah, well, so my co-founder would probably kick me for saying this, but she's been doing this work for about 25 years. And so, which is impossible because she's only like 28. But she, it's been a long process of learning how to ask these questions, what questions to ask, what questions not to ask, how to sort of like show and hide questions based on a client's situation, so that it's the most efficient and sort of doesn't clutter up the screen. So she's been sort of honing the question set for a long time. We do need to add new questions from time to time, and especially when we work with partners who want to add custom benefits, we need to add those questions as well. But just, generally sort of, we want to ask as little as possible and give the client as much as possible with asking for as little personal information as we can. We really want to just not know, we frankly want to know nothing about the client, so that they can feel comfortable giving us the information, and then they can go and sort of work on these benefits with the coach or on their own. Just sort of go back to the shame question a little bit. Like I'm a I'm a benefit recipient myself. My children receive CHIP. It has been a lifesaver, like literally for my daughter. And so we we understand that there's a huge amount of societal burden around this, and we think that informing the client, putting them in a position of power to walk into the food stamps office, for example, and say, I'm eligible for $300 in SNAP, is a much different scenario than sending them in and having them say, am I eligible for SNAP? Right. And so we just want to sort of inform the client so they can go and make these moves in ways that make sense for them and their family.
Love that. It's a great note to wrap up on. Thank you all so much for this presentation. We have a couple upcoming events on the next slide. There will be a webinar on July 13th around uplifting communities through fintech, building a pathway to financial inclusion. In the fall, we'll be hosting our Emerge Insights event in Philadelphia, a two-year event in person, a two-day event in person. It's a great opportunity to meet like-minded folks in the financial health field. And then save the date for June 2024 in Chicago. We'll be celebrating 20 years of the Financial Health Network and looking at kind of what the next 20 years will hold for our work here at Financial Health Network and for the field. So thank you for being here with us today, and we hope to see you on a future webinar or at a future in-person event. Julie has just dropped a link in the chat where it says join the exchange, essentially signing up for our newsletters. So you'll be sure to hear about future webinars like this one. Thanks so much. Take care.